name's Alex Barnard. I'm a third year student paramedic and a student ambassador for the School of Health and Social Care. And these are my top tips for health and social care students. So accommodation wise, it's worth obviously because you're going to be going through so much uniform, and you're going to need, because of infection control, you're going to need clean uniform per shift. Try getting somewhere, if you can afford it, with a washing machine and a tumble dryer, just to stay on top of washing your uniform rather than having to go down to a washroom and getting it all washed in laundry. So whilst you don't need a car for any of the courses at Lincoln, it is definitely beneficial to have a car or some sort of your own transport rather than having to use public transports. Lincolnshire is such a big county, getting to some of the places that you will be on placement will be nigh on impossible without your own transport. So for example, my station was Horncastle. All of the shifts were 6 till 6, so getting to Horncastle on a Sunday morning for 5:30 would be impossible without having your own car. And so it's really important to get your name down for your accommodation early, and so that as soon as you've got a guaranteed place at the uni. When you're looking, make sure that it includes parking, a long tenancy length, so making sure it goes to probably early August, and making sure that it's got some sort of washing machine facilities as well, again for uniform. The other thing is making sure that it's got some sort of freezer facilities as well, because it is really, really useful to bulk cook when you've got time off, and then you can use those for your shifts as well, and it makes it cheaper too. Trying to figure out placements and university work and everything can be really hard too, so getting something like a big wall planner and marking on when you've got all your assignments due and when all your placements are as well is really good, so you can then think of when you can actually go out and have a bit of a student life as well around that. It's really important to register with your university GP because of the intensity of the course. Chances are you're going to be here for the majority of the year. However, prior to the course you don't need to worry about anything like your vaccines or any blood tests. That will all be sorted out in the first months or so of the course. Uniform is all sorted here as well, and when you go on placement itself, it's important to remember, along with all of your own kit, to take maybe a notebook and maybe something like a deodorant or some cheap perfume to take with you as well. It's always useful because there might be some interesting smells. Make sure you utilise the library as well. You can go there instead of having to buy books. They have all the books that you'll need there, all the books that's on your reading list. So instead of investing a lot of money in books, go there and look through all the books you need. And it's a really good study place as well. They're open 24 hours during the majority of the term. So these are really tough courses. They're fantastic and you will have your best time here. They are definitely worthwhile, but they are all very, very tough courses. And the things you'll see are unlike any other courses that the university has. So it is really important to stay on top of your own well-being, and that can come into prioritising or making sure you still have a social life, making sure you have some sort of social support as well, talking about jobs you've been to with the crews that you've been on, with the people that you work with in hospital, and talking about it with people who know, like your course mates. There's also a very good wellbeing team here at the uni who you can talk to, as well as different people through your own trust that you're working with. So whether you're a nurse in hospital and you're working with your team there, whether you're on the ambulance, EMAS themselves will be able to offer support and counselling, and the lecturers here also do provide a lot of support. It is just really important to talk about things when it happens rather than letting it build. And prioritising sleep is also a big part of that as well. Obviously your resilience goes down with the lack of sleep, and that is really hard between night shifts and things, etc. So it's really important to prioritise yourself, because you're not going to be able to look after anyone else without prioritising sleep and yourself. Prior to placement, make sure that you know your route there, so whether it's practicing your route, whether through public transport or driving. Make sure you know about parking when you get there as well, whether you need to pay for parking and how to claim that back. And also make sure that you know different timings for different times of the day, for different shifts starting as well. So sometimes you might need to leave a little bit earlier. When you get to placement the first time, it's important to try and get in contact with your mentor prior to starting your shifts, so you can just have a bit of an introduction. It's always good as well to take biscuits or chocolate on the first shift. Be really open to any job that needs doing when you're on shift. If you're open and you're ready to contribute, then your chances are that you'll be given more opportunities as well. There's no stupid question when you're on shift as well. Any question that you can think of. Food-wise, make sure that you've got your food prepared for shifts in advance. So if you've got a block of, say, 3 night shifts, prior to those 3 night shifts, make sure that you have all your food prepared for those 3 nights, and try and spread it across what would be those hours. So you'd want something maybe midway through and something a little bit to get you through that last bit as well, and then snacks all the way. It's always good as well if you're not in a specific location for your shifts, to take something warm with you, either that you could heat up if you have got a microwave, or something in like a thermal flask, because that is very nice and early in the morning. Uniform wise as well, make sure your uniform's all prepared prior to your shifts. So again, if you've got a block of shifts, make sure that you have all your uniform clean and tidy, and it's always worth taking clean uniform with you to shifts as well. Sleep wise, it is a bit hard to change your sleep pattern for shifts. So make sure if you've got night shifts, it's in finding something that works best for you. So whether that's going to bed early that night, getting up early the day before your shift, doing something active, going to the gym, or just going for a walk into town and then going back to bed for a nap to early afternoon, ready to go for your night shift, or whether it is to stay up really late the night before and then sleep in for the first night as well, or first day as well before your night shift. Also, it is worth bearing in mind that before your first day shift, it's really hard to sleep. So that's just worth accepting. So job-wise, it's really hard to fit in like a part-time job alongside the course. So something like a job on bank is really useful. Working as a student ambassador, you can fit it around when you're on shift or when you're in uni. So the student ambassador as a role is a really good paid role to get experience, talk to people, and get paid as well. If you want to get to know each other before starting the course as well, you can use Discord, which you should have the invite to. You can talk to people on your cohort, ask any questions, and just get to know each other. And those are my top tips for health and social care students, and I wish you all the best. Good luck.